through a kind of a brief overview story.
Briefly, so in July of 2017, I went for a MRI of my back for recurrent back pain, and then the results showed that there was a lesion or a mass on my kidney as well, on the opposite side, and it had actually been there 2 years prior to that. Like in 2015, I had another MRI for back pain, and it was there but was missed. And so I went for a CT in August of 2017, and the results there showed that it was pretty much renal cell carcinoma. And then when my family doctor told me that that's what it was, I knew right away that I wanted Dr. Potler to be my doctor, just because I knew of his expertise in the area. And so he was great. We looked at my CT together, and he decided that he'd be able to remove the cancer by robotic surgery. And, okay, help.
Yeah. So just let me ask, so how do you know that you said it was missed in 2015?
It showed up on the MRI in 2015, but the findings were missed on the paperwork for further follow-up. So when I went back in 2017, it had grown from, I think it was 2.1 centimeters to 4 centimeters. I think it was something like that. And then it said it was recommended 2 years ago in a prior MRI for further investigation, and they didn't notice anything being done. They didn't see any investigation being done, so that's why I went for a CT.
Right. And I wonder if you could, and this we might end up using this earlier, but
Okay.
I wonder if you could tell me your profession,
Okay.
and just tell me a little bit about yourself prior to this, and also the fact that because you're a nurse, you bring to that a lot of knowledge, and it was probably one of the reasons why you also wanted to go right to Dr. Potler.
Yeah. Well, I'm a registered registered practical nurse. I was going with the old school RNA, but I'm an RPN. I work in the operating room at St. Joseph's Hospital here in London. And I went to Dr. Potler because I knew he was the best. That was my feeling. And I've known all the work that he does, and I've seen him. I've actually worked with him, not doing robotic surgery, but I've worked with him every now and then.
Can you recall any questions that you had at the time about robotic-assisted surgery?
I haven't actually, I do work in the operating room, but I haven't actually seen it done. I've seen bits and pieces, if I walk into the room to get something or to ask somebody something. But it seemed, I've done laparoscopic surgeries, so I kind of had an idea of what it was going to be like, just the instruments were different than what I'm used to seeing. I don't know.
Are you able to give us just a bit about your journey just prior to surgery and surgery?
Oh, after finding out that it was most likely going to be cancer, renal cell carcinoma, as Dr. Potler had said in his interview, yeah, the mental part really started taking over, the mental health issues. It became something that I couldn't stop thinking about because I never thought that I would be dealing with something like this. And I was actually one of the different ones that I could have waited till November is what we were looking at for my surgery date, and it was found in August. My stepdaughter was getting married in October, and I couldn't get past thinking about having cancer. So I talked to Dr. Potler to see if he had an opening sooner than November, just so I could have it removed, because it was just taking over all of my thoughts. And I wanted to be able to enjoy my stepdaughter's wedding after having it removed. And same with my family. They just wanted it out as soon as possible. So.
And then can you walk us through the recovery phase?
Okay. The day of surgery, very nervous, even though I had the access. I kind of handpicked my whole team from working in the same OR that Dr. Potler was going to be doing my surgery. So I had all the confidence in the team, but I am still human, so I was extremely nervous. And post-op, I didn't really remember much the first day. I was very, very sleepy. I had a catheter and a drain, and once that was removed, I had my surgery on the Tuesday morning. It was actually the day after my birthday. I had surgery the Tuesday morning. On the Thursday morning, I had the catheter and the drain removed, and I felt a lot better after that. So then I started ambulating more because they told me I had to be moving around more to be able to go home, and actually surprised my husband when he came back because he didn't think there was any way I was going home that day. But I had been walking around since he had left in the morning, and I was able to go home on the Thursday afternoon. At home, I spent many days and nights in my reclining chair. That was pretty much a godsend for me, because to have to get in and out of a bed, it would have been a lot more difficult. And I know I drove the next week, and I went back to work after 6 weeks of being post-op, and back to full duties 3 weeks after that, so full duties in the OR after 3 weeks going back. So it's a total 9 weeks.
And at that point, was there all of the different activities that you did beforehand? You were essentially back to all the
Yep,
same?
I think so. I did have pain afterwards. Dr. Potler is shaking his head agreeing. Yeah, I did have pain afterwards, but everything, all the testing and imaging that I had after my surgery, that all showed fine. So I think it's just the post-op stuff and getting used to all the like little scar tissue and stuff like that developing.
And could you play piano better afterwards?
Yeah, no.
Okay, let's see. So what of those questions do you think you want to pose directly now?
I think overall satisfaction, or kind of now, 3 years post-surgery, how do you feel? Where are you at now is probably a good question.
Where am I at now? I'm NED, which is no evidence of disease. So I'm very grateful for that. Felt very fortunate, still feel very fortunate that I was able to have robotic surgery with Dr. Potler, because I just know that the expertise that he has in that area. Very knowledgeable, personable.
And were there any support systems that you had that you rely on and that are out there for?
Well, I did find Kidney Cancer Canada. I searched, and that's what came up, and I thought, this is perfect, this is exactly what I needed. So I've been on there ever since my diagnosis. I'm on some Facebook groups, just getting, a bunch of people talk about their situations. So there, and I work in the operating room, so I have a lot of support there. I see Dr. Potler there quite often, so if I have any issues, I talk to him then. And like I said, the nurses there, they help me out, my friends, family. That's all the support. But yes, Kidney Cancer Canada was one of the first ones that I went to.
So did you have any trepidation, any fear about the robotic surgery?
No, I didn't. I was nervous about the surgery itself because I didn't have surgery, have never had surgery that long before. That would take that long. But the surgery itself, no. I had all the confidence in the surgical team that was there, Dr. Potler.
What would you suggest that patients ask the surgeon about the robotic surgery?
What the post-op, how they would feel post-op, or what the incisions were going to be like, how many incisions am I going to have? Those are things that I think I knew them because I work in the operating room, but I think people that don't have an idea of it, that would be something, that they should ask, what kind of activities can I do afterwards? How long do I have to wait to do certain activities? I don't know.
Right. And maybe also the question of what should I do in preparation for the surgery?
Oh. Well, I was supposed to lose some weight, but I didn't. It was too hard to do, and for me anyways, it was too hard for me to do. And I think with the mental part, anxiety, that all kind of took over, and I just said, can you please just find time to do me sooner rather than later? Now, before the surgery, it's very, very a lot of fun with having the full fluids for a whole day and clear fluids the next day, and Citramag on top of that. It's really a pleasant 2 days before surgery.
I'll put a big smile on your face when you say that.
What? Yeah, oh, I know.
Yeah, he's going, yeah.